If you are struggling with low AMH, poor egg quality, or recurrent pregnancy loss, you know how isolating and frustrating it can be. You've probably done some of the usual tests, but you feel like the real answers are missing. Today, we're cutting through the noise and going to explore the top functional labs that can uncover hidden issues, plus our top 20 blood markers to look at and the optimal reference ranges for those so you can dig deeper. This is especially important if you've been told everything is normal, but nothing is working. You're getting abnormal embryos, you're having pregnancy loss. And let's dig deeper with this episode. Excited for you to listen. Let's go. Welcome back. I'm Sarah Clark, founder of Fab Fertile. For over a decade, my team and I have helped hundreds of couples improve their chances of pregnancy success, whether naturally or through IVF. We specialize in supporting those with low AMH, high FSH, diminished ovarian reserve, premature ovarian insufficiency, or recurrent pregnancy loss through functional lab testing and personalized fertility strategies. Today, we're digging into the top 20 blood tests and functional lab tests to improve egg quality if you've got low AMH. This episode is for you if you want to go beyond the standard fertility test, uncover hidden factors impacting your egg quality and ovarian reserve. You're struggling with low AMH, poor egg quality, recurrent pregnancy loss, and you need clear guidance on the most effective labs to run. And you're ready to take a personalized functional approach to optimize hormone balance, reduce inflammation, and support mitochondrial health so you can get pregnant. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe or follow. And if you know someone else who's on the fertility journey, please share this podcast with them. Okay, so let's get into the episode. So we're doing these top 20 functional blood markers. We have an extensive list of blood work. These are the top 20, but we do a deep dive into all the blood work and really it all matters. But let's just pick some today. And these are some that your doctor may run or they may not. And a lot of this is different because we're looking at optimal reference ranges. A lot of times we're being told everything is normal, but we want to make sure it's optimal for fertility. So they're just tighter reference ranges. It flags it earlier before it actually goes to disease. And so let's start off with AMH, so anti-Müllerian hormone. Done a lot of talks on this, and basically this is a poor predictor of pregnancy success. It is a marker to see how well you'll do with IVF, and it does not predict your ability to get pregnant naturally. It does not check your uterine receptivity. It does not check your egg quality. It's seeing how well you'll do with IVF. We don't want to be blind to this number. We don't want to ignore it, but we want to not hang our hat and think that's the end of the line because it's low. So low would be considered around 0.5 to 1 ng per ml. So they may give you a diagnosis of diminished ovarian reserve. We don't focus on the diagnosis. We're looking deeper. Why are these numbers off? And if it's very low, less than 0.5, they may tell you have POI, which is so 0.5 ng per ml. So low indicates reduced ovarian reserve. Again, it doesn't predict your egg quality. It signals a need to look deeper. Inflammation, mitochondrial health, nutrition, and high, it might be PCOS. Follicle stimulating hormone, normal, like it below 10. If it's diminished ovarian reserve, 10 to 15. Advanced diminished ovarian reserve, 15 to 25. POI, anything more than 25 to 40. So we've had people's FSH all the way up in the 70s, 80s, come down below 10 and be able to get pregnant. So we want to know these numbers, but we don't want to focus in on them as that's the only thing we can do. So if it's high, the brain is overworking to stimulate the underperforming ovaries, and it may reflect poor ovarian reserve. If it's low, it could suggest amenorrhea or over suppression with the pill or hormone replacement therapy. Estradiol, E2, we like to measure this in day 3, and we like it between 25 to 40 pg per ml. If it's high, it can falsely suppress FSH and suggest diminished ovarian reserve. If it's low, it may reflect poor follicle growth or perimenopause. Again, we're not diagnosing. We want to look at all these numbers, and you need to be able to look at the overall picture of things. Your LH, luteinizing hormone, we like it on day 3, 3 to 8 U per L. If it's high, it could be PCOS or premature LH surge, or if it's low, it can indicate poor pituitary signaling or that hypothalamic suppression. Progesterone, we like this in the mid-luteal phase, the optimal range, 15 to 25. And if it's low, it suggests poor ovulation or luteal phase defect linked to pregnancy loss, or if it's high, it could be due to supplementation. Prolactin, we like this between 4 to 15. If it's high, it could disrupt ovulation and lowers progesterone. It can be driven by stress or pituitary issues, and low, maybe pituitary dysfunction. DHEAS, so 20 to 29, like at around 200 to 380 UG per DL, and then from 40 to 49, 30 to 250. If it's too high, it could be common in PCOS. This can cause egg quality disruption. If it's low, potential adrenal dysfunction, and we dig deeper with this one. And this is one where we can supplement too. We will supplement DHEA, but we're always looking at the targeted diet and lifestyle changes along with it. Testosterone free in total 30 to 50 ng per DL, free testosterone 0.5 to 2. It can be, if it's high, it could be linked to PCOS and ovulatory dysfunction. If it's low, there could be issues around adrenal output or chronic stress. We need to dig deeper on that one. TSH, we've done a lot of podcast episodes on thyroid, and we don't just focus on the TSH. We need to look at the full panel, including antibodies. The TSH, you want it between 0.5 to 2. Even your REI is going to want it below 2. They might put you on medication to lower it. We want to know why it's low to begin with, looking at the diet and lifestyle changes to be able to optimize this. If it's high, it could impair ovulation, increase pregnancy loss. If it's low, there could be, maybe you've got too much thyroid medication you're taking, or there could be hyperthyroidism. Free T3, we like between 3.4 to 4.4 pg per ml. If the free T3 is low, it's going to impair your cellular metabolism. Hormone balance is needed for ovulation, implantation, making and maintaining pregnancy, so that could make conception more difficult. If it's high, it could indicate over-medication or early thyroid issues. Free T4, we want it between 1.4 to 1.8. If it's low, it could reflect low thyroid input. If it's high, it could be seen in hyperthyroid issues or thyroid hormone overuse. Sometimes we see people just taking too much thyroid medication. So it's really important to work with your physician on this and get this monitored. Reverse T3, we like it between 10 to 15. Could be high due to inflammation, stress, toxin exposure, and it may, if it's low, it may suggest that it's not converting properly or chronic fatigue. Thyroid antibodies, we like these below 10. And so if they're high, we see people in the hundreds, 900s. So if those are high, it can disrupt your ovulation and increase pregnancy loss. Fasting glucose, like that between 75 to 85 mg per DL. If it's high, it's going to impair ovulation, raise oxidative stress. If it's low, it could be hypoglycemia or adrenal dysregulation. Fasting insulin between 2 to 5. So if it's high, it could signal insulin resistance, which is common in PCOS, and poor egg quality. Or if it's low, it could be seen with blood sugar instability or under eating, which we see this a lot. People are not eating enough food. Hemoglobin A1C, 4.5 to 5.3. If it's high, there could be oxidative stress, which is going to impair the mitochondria in the eggs. If it's low, it can reflect adrenal or dietary imbalance. I've done lots of episodes on blood sugar, which I'll link in there, on thyroid, obviously on AMH and FSH as well. Homocysteine, done a whole podcast episode on homocysteine, between 6 to 7. If it's high, it can reduce ovarian blood flow, impacts your methylation and egg development, and then it also may indicate a B12 or folate deficiency, or maybe you have that MTHFR gene variant, which 60 to 80% of the population have that. So dig deeper into that podcast episode there. If you want to send me a message too, if you do have the MTHFR gene variant and looking for strategies to help improve pregnancy success, send me a message at hello@FabFertile, subject line fertile, and we can chat. And if it's low, which can be rare, it could signal over supplementation. The high sensitivity C-reactive proteins, so CRP, like it below 0.5. If it's high, there could be low-grade inflammation, which can impair your implantation and your egg quality. We do see this a lot with the CRP being high, a lot of times in guys as well. You want it low, which is ideal for preconception. Ferritin, we like that to be between 60 to 100. If you're doing an IVF or an egg retrieval, ideally having a ferritin between 80 to 100 for best outcomes. Low, it's going to reduce oxygen delivery to the ovaries and impair ovulation. High, it could drive oxidative stress and inflammation. Vitamin D, done many episodes about vitamin D. We like between 60 to 80. Low is associated with poor egg maturation, implantation failure, immune dysregulation. It can be low because you have gut infections. And so the health of the gut is highly tied to this, and you can supplement, but it's not all just about supplementing. We need to dig to see why it's low to begin with. You can be careful if it's too high, that could be toxicity, but you got to work with a practitioner on that. And again, we're not diagnosing. These are optimal ranges. This is for you to dig deeper, understand your own health, because a lot of times we're told things are normal and something obviously is wrong. All the retrievals are failing. The embryos are being abnormally tested. You've got diminished ovarian reserve, premature ovarian insufficiency, recurrent pregnancy loss, and you're trying to figure out what the heck's going on here. We have a whole 2-page list of blood work that we're looking at. These are the 20 we decided to talk about today, our top ones, but we have a lot more, and it's all customized for you. We need to see what is out of balance and uncover hormonal imbalances, which is going to impact your ovulation or egg maturation. Reveal inflammation. Got a whole episode coming up on inflammation. Oxidative stress, nutrient deficiencies. We see it all the time. That's going to then impact your hormones and your ability to have this work. And then these functional range are looking at patterns, and conventional medicine is going to miss this. And it helps us really personalize our care with our team. We have an OBGYN with a functional medicine background as our medical case reviewer. We have functional nutrition practitioners that review all of our testing, looking at blood work, looking at your health history too. It's not just about focusing in on all the blood work. We need to look at your symptoms. And then also the fertility mindset coach is actually helping you implement all these changes and work on your stress, which then helps improve everything, because our whole thesis on, is it actually early menopause or is it your adrenals that impact your thyroid, impacts the AMH and the FSH and the follicle count, and the whole thing just cascades in the wrong way. But there's things we can do to right the ship. And then, so we look at blood work, and then we also look at some functional lab testing. These are tests that your doctor is not going to have access to. So we ship these tests worldwide. Obviously, depending on where you are, we need to check to see if it's possible. But definitely to places in Europe, definitely Canada, definitely the US, definitely Australia, New Zealand, definitely the UK. We can look at other places too and see if we can get them to you, but we ship these tests worldwide. So we look at food sensitivity tests. I can pinpoint delayed food reactions, this very restrictive diet, because you've got gut infections and inflammation in your body, and all this is going to then impact your ovarian reserve and maybe a reason why there's failed implantations. In the States, we like the Vibrant America, the Zoomer food sensitivity test. So that one is our favorite. I've done a lot of episodes all about the GI map test, and I do caution you just to do one GI map test and think this is the be all and end all. We need to look at things in conjunction with your health history, looking at blood work, and looking at some of the other tests as well. Stool test, it's going to look at infections. You can eat the most pristine diet. If you've got infections there, we need to address it. Inflammation, maybe you're not detoxifying all these toxins you're exposed to. Nutrient absorption, if you've got infections, you can't even absorb all your nutrients. And so if you got a good healthy gut, that can help with your hormone balance, and then better nutrients are going to be delivered to the cells and the ovaries. So yes, we do the GI map test. And we do genetic testing, different from what you do at the fertility clinic with the karyotyping testing. We're doing genetic testing. We use the Grow Baby test, and that will help improve pregnancy outcomes, prevent gestational diabetes, prevent preeclampsia, get the body in the absolute best shape based on your specific gene variant. So what are the diet, supplement, and lifestyle changes to actually personalize this for you? So we can look at your methylations. Maybe you need more methylfolate. We can look at inflammation markers. We can look at your vitamin D, your glucose, your thyroid. Maybe you have a genetic predisposition, but that's not your destiny. With epigenetics, there's things you can do to improve this. All of this is going to help take out the guesswork. We can throw a dart at a dartboard in the dark and just hope for the best, or we can actually do this in a targeted manner, not just generalized recommendations. When we do it in a targeted manner, improve our egg quality. And we do Dutch testing, dried urine testing. So there's a lot of excitement about the Dutch test, and we like it too, but it's just, again, this is not the be all and end all that we're going to do a Dutch test and then think that this is going to be the thing that's going to solve our issues. We could make assumptions here that your adrenals are completely fried and we need to nourish those. And then we can do some of the stool testing and food sensitivity testing. And so basically the tests that we start out with are the food sensitivity test, stool test, and the genetic test. And then if we need to see in black and white what's happening with the adrenals, which pathways the hormones are going down, we can bring in the Dutch test. And that can help with your cortisol to see exactly how the cortisol rhythm that you have, why you may be low in progesterone and estrogen, and how stress is impacting your ovulation and your hormones. And so sometimes seeing stuff in black and white, it can help us just say, okay, yeah, I got to pull back on that job. I need to deal with that toxic relationship. I need to set boundaries. I need to sleep. I need to address all these toxins. So that can be really helpful. Vaginal microbiome, done podcast episodes on the vaginal microbiome. If you've got infections in there, bad flora equals inflammation, pregnancy loss, failed embryo transfers, even if you have high quality eggs. So we have got to look at the vaginal microbiome before you go and do any kind of IVF transfer. I would say, again, not cherry picking off a vaginal microbiome test and doing that by yourself. We need to look at the gut infections and the food sensitivities and bring it all together. So they've got people doing a vaginal microbiome, but they never worked on their gut microbiome. And they wonder why it's still not working. So especially if you've had pregnancy loss, and really anyone on the fertility journey, but especially if you have had pregnancy loss or endometriosis as well, you have got to look at the vaginal microbiome. We have access to these tests. We ship them worldwide. Hair tissue mineral analysis. It can look at your mineral status. If you've got heavy metal toxicity, so the ovaries need magnesium, zinc, selenium to develop high quality follicles. And a lot of this is not visible on blood work. And so this is a very inexpensive, but extremely powerful test. It can also be used during pregnancy to further optimize your health. And then some optional tests we can look at. Again, we're not ramming all these tests down your throat. And if we do bring tests in, it's over a period of time. But we start with those three: food, stool, genetics, blood work for both you and your partner, and semen analysis. We got to do a semen analysis, including DNA fragmentation. But we can do an organic oats test. You can look at your mitochondrial health. You can see if you need any more B vitamins, your detox function, if there's any hidden yeast or mold activity. A lot of people are like, I've got SIBO, I've got mold. If you start working on the food and the gut, those things can start to clear up. And sometimes we do need to bring in an oat, but it's not our first kick at this. Mycotoxin testing, we can look at if you've got chronic mold exposure, that can disrupt your hormone balance, your immune system. It can lead to poor IVF outcomes. So if you've lived in a damp home, if you're in Florida or some of these damper states, if you've got chronic sinus infection, this may be the missing link. Again, we will bring this in a little bit later, or depending on your health history, it's just a big red flag. We might bring it in the beginning, but this is all personalized. These are tests that are typically not part of your fertility workup, and they're likely been missed. And so you can really tailor your testing and look at symptoms, look at your health history, and then develop a plan. So it gives you that clear path. So you can help optimize your egg quality. You can actually do something about it naturally, or if you do need to go to IVF, you can decide to do that too. So here's a story with Annie and her husband Miles. They were told that IVF wouldn't work for them, that donor eggs were their only option. Her husband Miles faced sperm issues. He had surgery to fix a varicocele. His sperm count was low. She had low AMH and high FSH. They worked on their health. They joined the Fab Fertile program, followed our method. They worked on food sensitivities and gut infections and blood sugar and thyroid, and really worked on their relationships, reduced stress, both high stress jobs, and really came together as a couple, deepened their relationship, and went on to have their son. So lots of stories like that where they take their health in their own hands, and sometimes they get pregnant naturally. Other times when they go to the IVF, it actually works. So you've got some embryos there waiting for you. And you want to make sure that when you do the transfer, so you start working on your health and get yourself in the best shape. Or maybe you decide you got a retrieval coming up and you want to have the best results. So it is really to use the testing, be your own advocate, dig deeper. If you wanted to get our eyes on your specific situation, send me a message at hello@fabfertile.ca, subject line fertile, and we'll give you some options to help. Take care.